Let's talk through a useful cue that you could use to free up motion here in the lower cervical spine. So when we're talking about spinal motion and we're talking about neck mechanics, the muscle that gets all the glory is the big neck muscle here in the front called the sternocleidomastoid, which is going to go from the collarbone and sternum, and it's going to attach right here behind the ear and the mastoid process of the cranium. And so even though this is going to change the orientation of the head and neck in space, it actually doesn't directly attach onto those lower cervical vertebrae. So it's not going to be the muscle that's most directly going to influence those mechanics. So when we're thinking about what muscles could directly influence those mechanics, the ones that come to mind are the anterior, middle, and posterior scalene muscles. So these are muscles that anchor to the vertebrae and then attach down here onto the first and second ribs. And so if they can't move freely, then we probably won't be able to move that lower cervical spine very well. So we want to think about as a cue is to create some space between where these muscles start here on the vertebrae and where they attach here on the collarbone and sternum. So the cue is going to be thinking about this space here being open, allowing this vertebrae to move back a little bit in space and keeping this space open. As we do some easy breathing, we're probably going to feel a little bit more motion there. As we turn the head side to side, we'll probably feel those upper ribs just move a degree or so, which is subtle, but you'll feel a little bit of a difference, and usually that makes neck rotation a lot more comfortable. Give it a shot. Peace.